Okay, this top area was a small incision that they made to help guide the line in place. It's covered in steri-strips. The steri-strips should remain there until they fall off. The area should be kept dry. So while showering, cover the dressing itself and this upper area with saran wrap. You can tape the edges and keep it nice and dry. If the site itself gets wet while showering, you should give your nurse a call and ask her to come and do a dressing change that same day. It should always be kept dry. So I used hand sanitizer, and I'm just going very gently, trying to support the skin as I'm pulling off the op site or this clear dressing. The edges of the dressing are getting a little bit pink, which indicates to me that you might be a bit sensitive to the adhesive. If that's the case, there's a dressing called IV 3000. It breathes a little more and is a little bit more hypoallergenic than the standard one that comes in the kits. So they can send that to you. You can ask them. They can send it next week and have her use those instead. The gauze is the most difficult part to get off because the adhesive sticks very well. I know, I'm sorry. Okay, I think that was the worst. All right. So the bright red blood is normal after the procedure. And you can see there's just a teeny tiny bit of blood right at the very top. So the next dressing change, you might have a bit of blood as well, but it shouldn't be bad. Now I'm going to put the gloves on. So you take the gloves by the cuff. They're cuffed inside out. And you put your hand in, find the thumb hole, only touch the inside of the glove, and then pull it up. And then now you can grab the other one, hold it in the cuff, only touch the inside, and put the glove in place. Now I can touch my sterile objects inside my kit and the patient, and that's all that I should touch. It's lined up generally in the order that it needs to be given. Alcohol is first, the betadine is second. You may get a kit that has both of these. You may have a kit that just does one cleaner. When you're cleaning this, you would start at the very center and very gently wipe the skin. I'm not going to wipe the opening right now with alcohol. It's sterile. It doesn't need to be done. I'm going to start here at the outside and just go out a little bit to get off the rest of that green sterilizer that they use. The skin's going to be sensitive, but once you've started in the center and worked your way out, you can't go back. So it's always center, concentric circles to the outside. And then I take the last one, and if I need to do the center again, if there's some scabbing or something, then I work my way down the line itself. Okay. I try not to move it too much on the first couple dressing changes because the area is very sensitive. So I've worked my way out, and now the povidone. I'm going to be careful with this one because it splashes and you get orange everywhere. Now this one is done last because alcohol cleans when it's wet. As soon as alcohol dries, its cleaning or antimicrobial properties are done. The iodine that comes in the kit continues its antimicrobial properties when it's dry. So it leaves a protective barrier around the line. And again, inside to outside. I'm not going to really get the exact site because that would be uncomfortable. So just get all the edges. All right, that's plenty. There's 3 sticks in each. I don't usually use all 3 of the iodine. It's usually sufficient. Now I'll take the large gauze that's in the kit, and I'll just set that there for a second. Let it help to dry, because you can't put on a dressing on wet skin. So it needs to be completely dried. You can either wait for it to dry, or you can just very gently dab it. And again, inside to outside. This area right here is reddened and swollen, and that's because the line had gone in and they really had to disrupt the tissue to get the line to go where it needed to go. So that's why that is so sensitive. You can ice that 4 or 5 times a day, 15 to 20 minutes at a time, and it really helps with the discomfort. Okay, now again, since this is new, I'm going to use some of the gauze that's in the kit. And I'm going to put some underneath the line to give a little bit of protection to the skin against the plastic, as well as these sutures. These sutures they're sharp, hard, pokey, and it can be very irritating to the skin. So I put the cut gauze, and then I will put the uncut gauze. So you have one under protecting the skin, you have one on top keeping it all together. So when you put on the adhesive is just attaching itself to the top. So when you take it off, you're not fighting with it to get the gauze undone from under it. Okay, now you have your gauze, you remove the backing, just touch the edges or your gloves are going to get stuck. It doesn't matter which way you do it, whatever looks to be comfortable and convenient for the patient. What I try to do is I try to avoid the areas that are getting reddened, but these 2 that are inside of the area that needs to remain sterile, I cannot avoid, unfortunately. So I'll put this like this so that I can avoid this top area, and I'm not overlapping the guide incision. Very gently. Just give it a little tap. And how are you feeling from your medication?
Fine.
Okay, good.
Isn't there a little ball, like a round thing they stick on?
They can do those as well. They've decided to do them in a mini bag or a piggyback. They can do the pressurized balls if that's more convenient for you. But they're smaller.
No, not that. On the change, there's these like they look like little discs that used to stick underneath the.
You can use those as well. They're little antimicrobial discs they can send to you.
Yeah.
You can put one of those on.
They send them to me.
So if you have one at the next change, have them put on that antimicrobial disc, and
instead of
skip the gauze.
Oh, skip the gauze.
Yep, just the disc. Goes right around the base of it, and that's it.
Okay.
So this is covered. This is all done now. All I'll do, everything is sterile. It's completed. I can take my mask off, because you always have to wear your mask when you're doing the dressing change. You don't want to breathe on the patient. That does come in your kit.
Okay.
And then I just use a bit of alcohol to take the betadine off of the edges so that you don't have to try to do it when you're home.